Our topic this afternoon is the use of cannabinoids in veterinary medicine. There's perhaps no other topic at this time that is relevant as this one, given the rapid changes we have seen in Canada over the past few years regarding the use of cannabis for medical purposes in humans, and the recent announcement that cannabis will become legal in Canada on October 17th of this year. For veterinary medicine in Canada, this change may greatly benefit our patients. However, we must explore risks and consider what gaps exist in our current knowledge and how we should address them. And this is why we are here this afternoon. The CVMA has been active on the cannabis file for the past several years, including an editorial in the CVJ, involvement in roundtable consultations with Health Canada, and formulating recommendations, including that veterinarians be granted the same rights as medical practitioners to access cannabis products for their patients. CVMA has also helped encourage improving labeling being put in place to protect animals and enhance availability of duly registered veterinary products containing cannabinoids. In addition, the CVMA has made online resources available on its website providing information on the safety of cannabis in pets. As with previous forums, we will hear during our first hour diverse perspectives from our three panelists, and then move on to an interactive panel discussion. So I'd ask you to please use your app on your phone to pose questions and answer the live poll questions that may arise. So if you check the app for today's session, then go to the bottom of today's session. There will be a session engagement where you'll see links to join live poll and ask a question if you would like to do that. Questions can be submitted during the presentations or during the break, and will be presented during the panel session after the break. This forum would not be possible without the generous support of our sponsors. On the screen, you will see the logos of our major sponsors, Curacor, Grey Wolf Animal Health, and Hydropothecary, as well as our supporting sponsor, Tetra Biopharma. Our major sponsors will in turn introduce each of our panelists in advance of their presentations. So I would now like to introduce the representatives of our sponsors, and they in turn will introduce the panelists. If you don't mind standing, Ms. Katrina Matouche, Sales and Marketing Director of the Cannabis team at Grey Wolf Animal Health. She will be introducing Dr. Sarah Silcox. I'll just introduce the other three, and yeah, you can come on up. Dr. Narda Robinson, President and CEO of Curacor Integrative Medicine and Education Center, will introduce Dr. L.P. Delormier, and Dr. Terry Lake, Vice President of Corporate Social Responsibility at Hydropothecary, will introduce Dr. Sharon Gwaltney-Brandt. First up is Dr. Sarah Silcox, who will be introduced by Katrina Matouche. Come on up, Katrina. Thank you.
My name is Katrina Matouche, and I am the Sales and Marketing Director of the Cannabis team at Grey Wolf Animal Health. It is my pleasure to introduce Dr. Sarah Silcox. Dr. Sarah Silcox is one of the founding directors and current president of the Canadian Association of Veterinary Cannabinoid Medicine. A small animal veterinarian with over 20 years of clinical experience, Dr. Silcox has been active in both general and emergency medicine, founded her region's first integrative medicine practice, and is currently operating the region's first veterinary hospice house call service. The team at Grey Wolf Animal Health is excited to be collaborating with Dr. Silcox on the development of cannabis education for veterinary professionals. And in addition, Dr. Silcox will be at the Grey Wolf Animal Health booth during the expo. So please drop by to ask the expert any of and all of your cannabis questions.
Good afternoon, everybody. Let's see if we can get through this. Here we go. So cannabis is certainly a hot topic, as you all know, and when we're talking about cannabis for veterinary medicine, certainly there's all kinds of aspects to that we're only going to scratch the surface of today, but I'm hoping that we can certainly answer some of your burning questions. Okay, there's another pun in there, burning questions, and it maybe spark some interest for you to continue learning down the road. I thought I'd start today off just by sharing with you how I got started in the cannabis area. And believe it or not, it actually started with a hot stock tip for a company that was involved with medical cannabis. As it turned out, that stock tip didn't turn out to be very profitable, But it did start me looking at medical cannabis companies, and the more I looked at those companies, the more I started to look at cannabis as a medicine and really dig into what cannabis was doing, how people were responding to cannabis, why were they using cannabis, and then since I'm a vet, the next question was, is this something that might help our patients as well? And so began the journey of starting to really dig into as much information as I could find about how cannabis works. Are there people using cannabis for animals? What results are they seeing? What are they using? Where are they getting it? And the more I learned, the more excited I became, and the more interested I was, and the more I wanted to learn. And conveniently, the universe kind of helped me out and threw some cases at me. I got a call right around that time that I was investigating cannabis from some clients who I'd met a couple times before on house calls with their not-so-lovely cat, Angel. After my first 2 visits, I had kindly suggested to Angel's parents that maybe they seek care in a hospital since I couldn't actually touch Angel on a house call basis. And it turns out that in this situation, they had gone to the clinic, and while the cat was hissing at the doctor, they had been able to diagnose an oral tumor. And so the clients were now calling me to come to the home and see her and talk about not only treatments for the tumor, but more specifically, they were concerned that Angel was constipated. And I didn't know how the heck I was going to do anything with a constipated old cat that I couldn't touch. But when I arrived, I was greeted with a cat that looked much more like the cat in the bottom. And to be fair, these aren't actually pictures of Angel, but they're very representative. So when I arrived, Angel was actually sleeping and resting comfortably, allowed me to pull her out of her bed and start examining her. She did protest. She did put up a struggle, but she was very relaxed. I was able to do a complete physical examination, did a rectal exam, pulled out some hard poop, gave her sub-Q fluids, gave her a couple injections. And this is because Angel's owners, who were both medical cannabis users, had already started her on a cannabis extract. Now, I would love to stand here and tell you that her tumor magically disappeared, but it didn't. Angel passed away about 3 months later, but I can honestly tell you that during that time, I felt that she was comfortable, relaxed, probably more so than she'd been in her entire life, and she maintained a great appetite and a really great body condition right up until that last few days prior to her passing. And then following Angel, I seemed to get more and more cases of patients where their owners were already administering cannabis or who started cannabis treatment. And each time I met with one of these clients, we'd have the talk, the one that you guys are all worried about, the talk about its legal implications, the talk about what we don't know, the talk about, I can't tell you what dose to use because we don't know, so start low, go slow. But I really committed myself to working with these people, supporting them as I could from a medical standpoint, and monitoring these patients really closely, intervening when I needed to help reduce or minimize any adverse effects. But I can honestly tell you that of all those patients, any adverse effects that I did see were negligible or minimal in comparison to the positive effects. So fast forward a few years, and somehow through the grapevine, word got out that this was an area I was interested in, and I was asked to speak at a cannabis conference. And so, nervous and apprehensive about doing a public speaking engagement, I wanted to make sure that I had all the information possible, and I started digging into all of our medical cannabis regulations, all the proposed legalization reports, and I started to get really frustrated because it became really clear that vets had been left out of all of these discussions and emerging regulations. And I don't know why vets got left out of the medical regulations, but I do know that the government didn't just decide to legalize medical cannabis. Those changes came about because patients fought long and fought hard for the right to access that as a medicine. And when I came across this report, which was from the Task Force on Legalization, I found a section where they had held an open consultation period. They had over 320 organizations that had submitted their opinions and thoughts on legalization, and many of those included medical organizations, advocacy groups, but also the colleges and the national and regional associations of pharmacists, nurses, doctors, and yet out of all of those medical organizations, there were none of our big veterinary groups. And in all fairness, I don't think they got invited to participate. In fact, I don't even think we made a blip on the radar. And so it became really clear that as veterinarians and as a profession, we simply weren't standing up and advocating for our patients the same way the human patients had. And I do have to tip my hat to the Vancouver Animal Wellness Hospital and Dr. Kathy Kramer. They were the only veterinary voice, but that was one voice out of a nation. And so again, as we were preparing for this big cannabis conference, and I was speaking to a lot of colleagues, we recognized that there were three big challenges that the veterinary profession had when it came to cannabis. One was certainly that advocacy component. The second was in regards to education. We really don't receive education on cannabis as a medicine or on the endocannabinoid system. And three was a lack of research. And so we formed the Canadian Association of Veterinary Cannabinoid Medicine to address those three big areas. When it comes to research, this is certainly an area that human physicians struggle with as well. As scientists and as medical professionals, we need that clinical data. We really do need more good quality clinical studies that are relevant and in our case, species specific, so that we can guide any future treatment with cannabis. And I'm excited to tell you that there is research coming. Dr. Delarmier will be speaking about some of that work. So I encourage all of you to stay tuned as more and more information comes about. With regards to education, I know Dr. Gottlieb-Brandt is going to talk about some of the really important aspects as it pertains to safety and toxicosis surrounding cannabis products. But there's so much more for us to know than just the bad stuff. We also have to understand what cannabis is, what's in it, how it works, and we have to have a basic understanding of that endocannabinoid system. And then finally, advocacy. And I am by no means saying that we're advocating that every veterinarian should use cannabis in their patients. Not at all. But I think as veterinarians, we have a long history of having the ability not only to prescribe, but to dispense almost every other medicine, regardless of whether that is an extra label drug use, a drug that's not approved for animal use, an herbal product, and controlled substances. We do it all. And we do those prescribing and recommendations based on what we understand as the benefits and the risks, and choosing a product that's going to ultimately serve our patient the best way we can. We want to choose products that are going to alleviate suffering and improve overall quality of life. But with all these new changes coming into effect, we also have to be able to have the discussion with our clients. And so that's another area that we feel really strongly about. A lot of veterinarians seem very apprehensive about having a discussion, and I think a lot of that fear stems from our regulatory bodies and what we at least perceive the rules are surrounding having these conversations. That kind of leads into our polling question. And if you guys haven't already, I'd encourage you to pull out your phones and just answer the polling question. Do you currently feel comfortable talking about cannabis and having that conversation with your clients, both from a knowledge aspect as well as from a regulatory point of view? Right? And this isn't totally unexpected. I think most veterinary professionals are still pretty apprehensive about having that conversation. And so over the next few minutes, I thought maybe what we could do is just go over three of the big questions that I get on an almost daily basis from colleagues and veterinary professionals. The first one is, how does it work? I mean, how is it actually doing all these things that people claim it's doing? And in order for us to answer that question, first of all, we have to start thinking about cannabis as a medicine. And ideally, when we're talking about medicines, we need to understand what the heck's in it, how that's working in the body on a cellular level, and then how those effects are going to produce a clinical change. But with cannabis, it's not just about THC and CBD. Those are the two big components we hear talk about a lot, but there's so much more to it than that. We know that there's over 400 chemical entities in there. more than 100 different cannabinoids. THC and CBD are just two of the big ones, but there are several different cannabinoids. We've got lots of different terpenes, which give cannabis and other plants their distinctive odors. They're what's found in essential oils, but those too have been shown to have medicinal effects. And then we've got bioflavonoids and fatty acids and phenols, and all of these have effects and properties individually, but then some of them actually work together synergistically and produce what's often referred to as the entourage effect. So this isn't just a nice simple tablet with one ingredient, it's a really complex plant and a complex medicine. And of course, in order to understand how that's working on a cellular level, we have to go back to this endocannabinoid system that none of us really learned anything about. And the ECS, which is the easy way of shortening that down, is now thought to be one of the largest regulatory systems in the body. It's common throughout almost every animal species, with very few exceptions. And it's made up of both naturally produced cannabinoids, or endocannabinoids, receptors like the CB1 receptors found primarily in the central nervous system and the brain, as well as some other organs. The CB2 receptors found in more peripheral tissues, and particularly within the immune system. There's enzymes that break down those cannabinoids. And then we've got this whole range of other receptors that are involved in the endocannabinoid system as well. That includes our other G protein coupled receptors like GPR55, 119, serotonin receptors, adenosine receptors, vanilloid receptors. We can actually get cannabinoids modulating opioid receptors as well. And that's why in human medicine, they're looking at cannabis as an answer to the opioid crisis. And when we talk about the endocannabinoid system, I love this analogy, especially when I talk to clients, about it being the Goldilocks system. It's a regulatory system that tries and strives to maintain a balance of homeostasis. And just like Goldilocks, doesn't like things too hot or too cold, likes it right in the middle. Not too hard, not too soft, right in the middle. And it does that through a whole range of systems that we deal with every day in our clinical practice. It affects the reproductive system, the endocrine system, the neurological system, the cardiovascular system, the integumentary system. Pretty much every system that we talk about, there's a role for the endocannabinoid system. And so you can see how important it is that we learn about it, not only from the standpoint of using cannabis, but more importantly, just to better understand animal physiology. Next question I get is whether we can legally prescribe cannabis. And what about CBD? And the short answer is no, not right now. What we do know is under the current regulations, cannabis and all its substances fall under Schedule II controlled substance. The only exceptions to that are under the medical regulations, which doesn't apply to us as it applies only to persons, and under the industrial hemp regulations, but those only provide an exemption for stalks and seeds, not products like CBD that are derived from hemp, which is a little bit different than in the US. Well, what's happening October 17th? Cannabis will be removed from Schedule II, but it's still going to be regulated under the Cannabis Act. Our clients will be able to go out and purchase and possess and share up to 30 grams of cannabis at any time. But those products that will be for sale on the retail side are being sold for human consumption, and none of those are currently approved as animal products. So any use of or recommendation to use those products might be considered off-label use. And this is still an emerging area. There's still a lot of questions to be answered, but we're hoping that the regulatory bodies will be meeting and will agree with that. The industrial hemp regulations are going to include processing for CBD, but breaking news, just last week, Health Canada announced that all phytocannabinoids will be added to the prescription drug list. And that means we'll have new drugs being developed that will be able to be prescribed and administered to both humans and animals. But that's still a few years down the road. So final question, what can we tell our clients? And that's the biggie. First thing I would advise is make sure you're aware of what your current regulatory body's position is on cannabis and respect those guidelines. But if your clients bring up the conversation, watch their body language and verbal cues so you can keep that conversation on their level. avoid passing judgment. You got to throw those stigmas out the window because these are people coming to you and looking for help. Advise them of the legal status, include reported cannabis use on their medical record, and also be aware of any potential drug interactions and potential side effects. Use evidence-based information to provide education about toxicity, as well as the possible therapeutic benefits. And certainly you can advise them of any current studies, what those results are, what the limitations of the studies were. Maybe the studies were only in one species, maybe it was a specific product. And heck, you might even want to go out and just familiarize yourself with what sort of products your clients are seeing when they go into their local cannabis store. Just like I sometimes wander into a pet store and look at all the different foods and supplements that they're faced with. And try and understand what the differences are. Maybe even talk to some of the educators in those stores. And for clients that indicate that they do plan to use cannabis, as long as it fits within the guidelines of your regulatory body, I would encourage you to discuss strategies for product selection and safer use to make sure whatever they are choosing to use for their pets is the ideal product. Definitely avoid making unsubstantiated health claims and avoid making any specific dosing recommendations that are not evidence-based. And I think this is an area that we'll have to pay really close attention to. As more and more studies come out, we may soon get more evidence-based guidelines on that. But remember, we should always, always be our pet owner's first line of information when it comes to questions about their pet health.
I'd like to ask Dr. Narda Robinson, CEO of Curacor, to introduce Dr. LP Delormier, please.
Hi, I'm Dr. Narda Robinson, President and CEO of the Curacor Integrative Medicine and Education Centers. It's my pleasure to introduce Dr. Louis-Philippe Delormier. Forgive me, I'm an American. After a Bachelor of Science degree from McGill in 1991, Dr. Delormier obtained his DMV from the University of Montreal in 1996. Following 4 years of general practice in Montreal, he completed a medical oncology residency at the University of Illinois in Urbana-Champaign from 2000 to 2003, where he was a clinical assistant professor until 2007. Dr. Delormier is the staff medical oncologist in a specialty practice on the South Shore of Montreal. Welcome to Dr. Delormier.
Thank you. I'm the one voice, the loud voice. What is it? What's the logo? One loud voice. I'll be the loud voice. So thank you. I feel like an imposter between Sarah Silcox and Sharon and being introduced by Dr. Robinson, but here I am talking about the expectations and what's, the research and what are the uses. Sarah alluded to it a little bit. I'm an oncologist, so I have a bias, clear bias. Bias is my patients die within a short span of time, and toxicity is not something I'm scared about normally because I give toxic drugs on a daily basis. So I wanted to start with a brief cannabis history. And what happened is we already had fire and dogs. So, you do the math. We started cultivating, at the same time, basically, as agriculture 10,000 years ago, hemp, mostly for pottery and things like that initially, but then eventually nutritional and medicinal in China around 4,000 years ago, uses started, and then other uses, as you know, religious and recreational uses as well. Its first recorded use in animals was in ancient Greece, where it was used to dress wounds and sores in battle horses. But interestingly, there's that paper that was published in 1899 by Dr. Dixon that evaluated the effects of Indian hemp on dogs, cats, and humans. And they used various ingestion routes, like it was ingested, or smoked. I don't know how they did that to cats, but and interesting results with cardiovascular effects and everything. But it then fell out of favor. Research fell out of favor as well in the 30s and the uses because of the law, first of all, the legal aspect, and the variability of the plant material and the shelf life and everything. And it was replaced by very safe drugs that are not problematic at all, like pure opiates and other synthetic drugs. Makes sense. Talk about the cannabis plant. Sarah did a little bit of it, but there is an interesting paper you should all there's this research, there's this journal called Cannabis and Cannabinoid Research, a journal of cannabis and cannabinoid research. And there was an interview with Dr. Russo, who's a very well-known medical cannabis researcher in the US. And the question was the sativa versus indica. And his point of view is that it's probably a single species instead of multiple species with various chemotypes. And if you think of it, a Chihuahua and a Great Dane, they're the same species, right? They don't look the same, they don't bark or bite the same, and they don't poo the same, if you ask me either, but they're the same species. So the important part is that you can take different strains and they will be different. But overall, when you look at cannabis, there's many different chemicals in it. The phytocannabinoids, and I know Sarah already talked about it, the terpenes are very important as well. The flavonoids, and you'll see some well-known names on there like silymarin and such, and then others, B vitamins, essential fatty acids. And then we talk sometimes about some people don't like it, but the entourage effect, which basically means that the sum is more than all its parts added, like the supra-additive or synergistic effect of using whole plant extract versus purified or synthetic purified, for example, cannabinoids. And for one thing, the non-psychoactive compounds may modulate the psychoactive compounds such as THC. So that's an interesting thing to think about. Now, the endocannabinoid system, Sarah talked about it a little bit. It was named after the plant. It's not the only system that's named after a plant, like the opioid receptors are named after the opiates as well. So at least 4 receptors that have been discovered. The main 2 are CB1 and CB2. They're G protein coupled transmembrane receptors. They're located in different places in the body, but THC has very high affinity for both, and CBD has lower affinity and may modulate the receptors. CB1 is in the central nervous system, which explains the effects on the body in general, and then peripheral as well, lungs, liver, and other tissues. And CB2 is well known to be present on immune cells, especially B and T lymphocytes, which has important implication for inflammatory diseases, but maybe even for cancer as well, and then macrophages, etc. And then the ligands to these receptors can be either endogenous, so that's an endamide, endocannabinoids, and endamide and others, or not, and that's phytocannabinoids or synthetic cannabinoids. And these can be agonists, antagonists, modulators. If you look into research papers in the US in the last 40 years, there's a lot of publications with synthetic cannabinoids that have been synthesized just to prove a point that if you do this antagonistic effect on CB1 or CB2, you have this. These are not compounds that will reach the market or are intended even for that. They're used for research only. The question here is CBD the good one and THC the bad one? And I hear that so often, and I see that on the news. CBD is good, THC is bad. No, it's not that simple. There's different effects. There's modulation of one by the other. There's dosage effect as well. And then there's the whole thing about entourage effect. So THC has very important effects that could be very beneficial in the medical, regarding medical use. And depending on what we want to achieve, a higher CBD or or higher THC ratio may be something you want to use. And for example, CBD for inflammation plays an important role, seizures, anxiety. THC may be more important when you have severe pain, when you want to act on the appetite side of things, or anti-cancer effects. And then obviously mixing all that together and the entourage effect probably, and even like when you talk about anti-cancer effect, there might be additive or super additive effect when it's combined with traditional therapy as well, or conventional anti-cancer therapy, I should say. But THC has been demonized because of the intoxicating effects and because of the law, of the legal aspects. And dogs are way more sensitive to THC than other species. They have way more CB1 receptors in their cerebellum, so that's one reason for that. Now, and this is just something I found on the net, like you'll see all those things. Does THC turn into CBD in our stomach? No. So, and vice versa. Why I am interested, Sarah started with that, I put it kind of in the middle, but we always need to find better and newer, better options. And I'm an oncologist, so obviously we do need to find better. There's so many cancers where we haven't improved survival rates or symptomatology and how to treat symptoms and everything, and side effects even of the drugs we use. And then questions from owners. I've had so many questions from owners over the last 5 or more years, and that is increasingly getting more frequent, obviously, with the with everything we hear and see in the news and the laws being changed. So, and currently it's daily, at least one patient, or one client or more. And could it be useful for the anti-cancer effects? That's definitely one thing I'm interested in. For the palliative effects or for concurrent diseases, because most of the patients I treat are older pets. So I was approached also to serve on an advisory board of one of our co-sponsors. So that's another reason that it became interesting to me. And then I was approached, obviously, by Enid Stiles to be on this issues forum. And I was like, what, is cannabis an issue? So, and that's a poll question. No, I don't have a poll question. So why am I interested? And there's this book from, and there's so much on the internet anyways. Clients and owners can find a lot of information, conflicting information, but a lot of information. And then Robert Silver published this book, which is, I think, selling well on Amazon. And I thank him. He's one of the acknowledgements because he sent me all his slides and stuff because he knew I was talking about this. So he's just a nice guy. So what currently supports the medical use in companion animals? Well, not a lot, but research is expanding, and there's many studies, obviously many studies shown that, pets have receptors. And I just put 3 up there. The top one is a very recent one discussing CB1, 2, GPR55 in the gastrointestinal tract of dogs. And these studies are happening on a regular basis. So these are in health. So that's a theory. So theoretically, if there's receptors, maybe using something that binds to them could be beneficial or not. And then in disease, there's as many papers in disease discussing maybe the presence of those receptors in disease. And these 2 are just, the bottom one is the recent one, very recent one from last month in veterinary dermatology discussing CB1 and 2 in canine and feline skin affected with dermatitis. And its expression or overexpression, actually the receptors are overexpressed in some disease states. So that means maybe we could use those compounds to have a beneficial effect there medically. The problem is there's many applications, many numerous applications, but all or most of the information currently is anecdotal or theoretical. So there's receptors, we have compounds to block them or to be agonists or antagonists for those receptors. So lots of potential applications, behavior, neurologic diseases, chronic joint pain, neuropathic pain, gastrointestinal signs, nausea, vomiting, anorexia, whether it's a symptom or whether it's a clinical sign or a side effect of a drug I use or you use, inflammatory conditions, and then cancer, obviously directly anti-cancer effects, either as monotherapy or combined with traditional conventional therapy. So is anecdotal evidence enough? Is it reliable? One guy says yes, well, I say no, and there you go, right? So let's talk about the growing interest still. I added that slide actually this morning because yesterday I searched on VIN just with the word cannabis, how many on the message boards on VIN, and there were 326 message boards. That's over the lifetime of VIN. That's not that many, but when you look on the right side within the last X years, so the last 10 years, 298, but of those 298, 226 are in the last 5 years, and of those 177 in the last 3, and 88 in the last year. So the frequency of cannabis being a subject on the message boards is going up, which makes sense. If you look at the first one on the left there, I like that one. Is it a problem if a veterinarian significant other grows cannabis? And the veterinarian wrote anonymous, like did not put his name. And I deleted, by the way, I deleted all the name except mine, not because I wanted to show off, but I wanted to, like this was one question about recently in November about cannabis and some sort of sarcoma. So ongoing studies, and that's where it becomes interesting because there's some studies that are ongoing, some were recently completed, and I don't think I have all of them, but I have most of them. One of them is we heard about probably because of the data was presented at VMX in February. There's the one by Joe Wachschlag at Cornell, and he did a randomized double-blind placebo-controlled crossover design study, which is the right way to do a study. PK, pharmacokinetics, and clinical study, 2 dosages of CBD, pretty high dosages compared to what most people use or recommend, which I won't talk about because I'm not here to talk about dosages today. But they were dogs with osteoarthritis. They reported no negative adverse events, even at the higher dosage. And the results supported a significant effect with reduced pain and increased activity. And these were statistically significant results. And the PK and safety study is also being completed in cats. Now, this is not published yet, but it was presented at a meeting. So it hasn't been peer-reviewed, but it's still interesting results. And the product they used was Elevet from out of Maine. And interestingly, it's not cheap, $120 a vial or $130. And on the website, and I put it in big there, I was surprised, and I put an exclamation mark made of buds of cannabis, but it says endorsed by veterinarians in a double-blind placebo. And I thought the word endorsed, I'm not sure if it's true, so I need to send this to Dr. Wachschlag to see if he endorses it or if it's supported by a study or if it's, the study showed that it had an effect, but is it endorsed automatically? So be careful what you say and what you do. Other studies at Colorado State University, I'm sure Dr. Robinson knows more about those studies than I do, but there was a study that evaluated safety of CBD in healthy dogs. That one is closed. There are 2 clinical studies, one with osteoarthritis and one with refractory epilepsy. And the OA study is closed. The epilepsy study is ongoing. And that's per their website yesterday, so I presume it's still true. And then they also have a hemp survey, questions for owners. And you can't answer it because you need to live in the US anyways to answer it. So these studies are ongoing and hopefully will provide interesting results as well. And this just out, I made up this slide also this morning. So a few days ago, it was announced that this company, CanPal, in Australia, just completed a phase 1A study where they evaluated pharmacokinetics and safety, aiming to treat pain. And what's interesting is it was a THC CBD compound mixture. We don't know the ratios. The compound is called CP-AT01. It's a proprietary compound, so we don't know the ratios. We don't know if it's an extract, purified. Are there terpenoids? Are there other components? Excellent safety profile at target dose, which we don't know what it was. No adverse events reported. Significant absorption is what they said in the current formulation. So there was good bioavailability, which is good. And then they're planning on a phase 1B to start in fall of this year, aiming at treating 48 dogs for pain. Planned commercialization in 2021. And also plan to evaluate the same compound, I think, in cats. Interestingly, their compound comes from Canada. So it's an Australian company, research is done in Australia, but they had an export license from Health Canada to get this compound from Afria, and Afria is in Ontario, right? Other ongoing studies, so there are some open label studies with CBD-rich oil in cancer patients that were or are ongoing in the US, non-funded. Some allow concurrent medication. Some allow addition of CBD on top of anti-cancer drugs. Another one was just CBD oil, no concurrent medication. And unfortunately, these pictures, the 2 pictures there, I don't know why they don't show up, but the dog on the left has a big squamous cell carcinoma on the tongue, and on the right is after 1 month of that oil, and that's the only thing that was used on that dog, so the tumor shrank by about 80%. The point is, it remains anecdotal because they're individual patients. The study is not really a study. Well, it's a study that was, this dog was part of a open label study that was closed because the veterinarian discussed with lawyers after the AVMA made their statement in January and were scared to use even just CBD, so they stopped doing it because, the oncologist that shared these pictures with me asked me not to say his or her name, so I won't. The product was HempRx. And then obviously they're scared of the DEA with the beautiful soaring eagle over a field of cannabis. It's a high eagle. That's the AVMA statement. I won't go through it because I see the red light flashing, but the last point is the FDA and the AVMA cautions pet owners against the use of such products. These products, despite contrary claims, are illegal for use in pets, and that includes CBD only, okay, so in the US. So that's why some studies were closed. In Canada, and I put it there because it's on the web. I'm not sure. Dr. Huntingford is in Ontario. She's doing currently a double-blind placebo-controlled study targeting 64 dogs. I didn't talk to her directly, but I got this information from the web with the inclusion criteria. And that information on the right is on their hospital's Facebook page. So that's another ongoing study in Canada. And soon to start, there's a few studies using a mixture of THC and CBD at various ratios for ocular pain in dogs, for anxiety, for cancer, for osteoarthritis. Some of those will be oral, like the oil, transdermal, ophthalmic drops, oral transmucosal as well. And as far the part I'm interested in is the cancer part. I've discussed with those guys. They're scientists. They're not clinicians. I've had to work a lot on the clinical trial design. But there's interesting stuff coming out of this research, even unpublished research, where they find out that some anti-cancer effects don't have anything to do with the cannabinoid receptors, and they identified specific terpenes that block a pathway that's crucial to this cancer, so they want to try it in that cancer in dogs. So there's interesting thing coming. And there's just images of IH. This is immunohistochemistry of human prostate carcinoma, showing on the top left, very low CB receptor, and on the bottom right, very high CB receptor. So these are potential tumors where these could be useful. Many different anti-cancer mechanisms. So the main problem with many products currently on the market, many don't have certificate of analysis. Many, they may contain contaminants. The concentration may vary from what's on the label. Some of them don't even have a concentration on the label. There's various extraction methods. So the problem is we never know really what we're giving. And is it really pure CBD oil? If you give CBD oil with almost no THC and the dog has urine leakage, and that's been reported in some of those, maybe it's not THC causing the urine leakage. Maybe it's terpenes. I don't know, but there might be other things in there, which could be a plus, but could also be a negative. And then it's not or poorly regulated. And then the claims, and Sarah mentioned that the claims, the FDA acted upon that a year or less than a year ago by issuing letters, warning letters to 4 companies with many claims, and you can read those right there. It cures cancer, right? So also currently you cannot prescribe, as Sarah pointed out. And the number of companies in Canada is growing almost every day. So I put a few there. Most of them, many of them are our sponsors today, and I thank them. And I thank you and Dr. Silver for sharing his slides, Dr. Chelsea Tripp for sharing some of her slides as well, and other oncologists that I cannot name that helped me and provided some information. And question and answers will follow, I think, the break. So thank you all.
I'd like to call Dr. Terry Lake, Vice President of Corporate Social Responsibility at Hydropothecary, to introduce Dr. Sharon Gwaltney-Brandt.
Thanks, and good afternoon, everyone. It's great to be back at a CVMA meeting here in beautiful British Columbia. I'm Terry Lake, WCVM class of 86, which Chris reminded me is like 32 years ago. I don't know where the hell the time went. But it's a great pleasure for me to introduce Dr. Gwaltney-Brandt. She's a diplomat of the American Board of Toxicology and the American Board of Veterinary Toxicology. Formerly the Vice President, Medical Director of the ASPCA Animal Poison Control Center, Dr. Gwaltney-Brandt currently works as a consultant for the Veterinary Information Network. She also teaches an online forensic veterinary toxicology course for the University of Florida and is an adjunct instructor at the University of Illinois. So please join me in welcoming Dr. Sharon Gwaltney-Brandt.
Thank you, Terry. Thank you all for inviting me. So we're going to start with something a little different. I'm just going to use the keypad, if that's okay, not the little clicker. There was supposed to be, after cannabinoids in veterinary medicine, there was supposed to be a toxicology perspective, but somehow that didn't get in there. I want to acknowledge the folks at ASPCA Animal Poison Control Center who graciously opened their database and allowed me to steal some data so I could provide you with some up-to-date numbers on cannabinoids exposures in dogs. Well, in animals, I should say. I'm going to default to dogs because, as we'll see, they account for 96% of the cases the Animal Poison Control Center gets when it comes to cannabinoids. As was mentioned, in the U.S., we have a little different situation than you all will have here. When you all start in October, it will be legal across all of Canada. In the United States, it's cannabinoids, cannabis is still illegal federally, which means that it's still a federal offense to own it. Now, we have a couple of, and it's also a Schedule I drug. So if you want to do research, you have to have special licenses, and it's just a kind of a big mess right now. We have a couple amendments. The Rohrabacher FAR, I think I misspelled Rohrabacher again, FAR amendment, which basically says that the federal government will stay out of medical marijuana situations in states that have declared it legal. That is an amendment that has to be renewed annually. There was also the coal memo, which said that the federal government would basically stay out of marijuana sales in states as long, both of those were as long as they didn't impinge on federal legislation such as violence or trafficking, that kind of thing. However, in January, the current administration rescinded the Cole memo, and the Rohrabacher-Farr amendment has to be renewed annually, so there's some question as to whether it's actually going to be renewed. So it certainly could be that in these states where they have dispensaries, they have all these things set in place, that in theory, the federal government could come in and shut it all down and send everybody to jail. Whether that happens or not, I don't know. Currently in the U.S., we have 9 states where recreational and medicinal marijuana is legal. We have several states, if you notice the very light green, these are states where all uses of marijuana are illegal. However, they do allow the use of low THC, high CBD compounds. So things like cannabidiol oil would be legal. The states kind of in the medium green, those are the states where it's medical marijuana is legal, and the dark green states, the 9 dark green states, plus the District of Columbia, medical and recreational marijuana is legal. Now, what we find in the U.S., and I was asked to give kind of the American experience with this, so what we find in the U.S. as far as from the standpoint of those of you working in practice is that whenever a state legalizes marijuana, there's about an 18-month gap between that and any increase in marijuana exposures in pets, and probably that goes along with the kind of infrastructure that has to be put in place once marijuana is made legal. They have to make laws and dispensaries and that kind of thing. And we certainly, three of the 9 states that approved marijuana several years ago are still not selling it because of those infrastructure laws. So even if our state, even my state of Illinois, it's legal medically, there's a recreational marijuana bill in the legislature right now. If it becomes legal, even if it's legal for us, we still have, as veterinarians, in order to get a DEA license, state DEA license, we have to have a federal DEA license. At least in Illinois you do. And so the concern is if I, as a veterinarian, recommend marijuana, even though it's legal for humans, if the DEA comes in and objects to that, are they going to take my DEA license away? And that takes away my ability to prescribe controlled drugs. So that's kind of the main concern we have here in the states right now. And so the general recommendation is we don't make any recommendations on pot in the U.S. So I wanted to give you some statistics just so you could fall asleep. Okay, we got the these are from the ASPCA Animal Poison Control Center. They very graciously opened their database and allowed me to play with them, and I promised them I'd write a paper at some point. Yeah, that's going to happen. So we used 15 years. The 2002 was when their new database that allowed us, well, actually 2001, they implemented a new database which made it a whole lot easier to sort through all the cases without having to go case by case. So that started in 2002, and then we went up to 2017. As you notice, there was a slow but gradual increase in cases over the years. These are cannabis cases. These are exposures. Okay, the animal got into it, whether or not they were showing clinical signs. If they're showing clinical signs, it's a toxicosis, and we'll talk about that in a minute. So these are the actual exposures across the country. The absolute numbers don't really matter because you got to realize that there are 2 animal poison control centers in the U.S., and both of them only get a fraction of the actual cases that occur because it entails somebody having to call Animal Poison Control Center. If we have a practitioner who's comfortable managing a marijuana case, they have no reason to call. You have clients that don't want to pay the fees that the Animal Poison Control Centers assess for the calls, then those calls won't be made. But what we can look at, though, are the trends, and that can help us out. So what I wanted to do was follow the number of cases, and of course they went up, and as we notice, the cases started to go up pretty dramatically here, starting about 2012, 2013. Actually, in 2012, the first 2 states had recreational marijuana was approved, Colorado and Washington State. But neither of those started selling marijuana until about late 2013 and early 2014. So as you notice, the bump isn't down there at 2012. It's actually a couple, 18 months to 2 years up, which again is kind of typical with what we've seen with other cases. And the other thing I want you to notice on here are the edibles, the blue dots. That the edibles are marijuana and anything you can eat. Marijuana brownie, marijuana candy. Now they have gummy bears. You name it, they put chewing gum. I just saw marijuana chewing gum. I don't know how that works, but I just saw it in the database, so it's there. So what we notice again, that those numbers are increasing, but also notice how exponentially they're increasing, so that by 2017, whereas in 2002, only 3 out of 98 cases involved edibles. In 2017, over half of the cases, more than half of the cases involved edibles. So what's that telling us? And I was thinking, well, that makes sense. We got more states with recreational marijuana selling it, and it certainly makes sense that that would be the case. So we like our edibles in the U.S., I guess. Now we're going to talk about cases that had clinical, well, actually, no, these are still exposures. I'm sorry, that label is a little wrong. Clinical signs, dogs account for 96%, cats 3%, and the others are 1%. And in descending order, birds, rabbits, pot-bellied pigs, ferrets, 1 chinchilla, and 1 miniature American miniature horse that was a service animal that got the owner's marijuana brownie and was trotting around the house, falling into walls and dribbling urine all over the house. But mostly we're talking about dogs, so you'll probably hear me default to dogs, and forgive me for that, but that's what we see. So when I look at all the numbers that the ASPCA gave me, 55% involved cannabis or cannabis species in something, or actually 55% were cannabis, sativa, cannabis indica, or cannabis species not mentioned, and the other 40% were edibles. So that's cannabis in something, and the remaining 5% were hemp, cannabidiol, other products that had hemp oil, hashish oil, that kind of thing in it that didn't fit in those 2 big groups, which is what I was actually kind of interested in. And when we see these increased number of exposures, it makes sense. You know, the drug's no longer illegal. You can have it in your house, so you don't have to keep it hidden away from family or law enforcement. So if it's more readily available and you don't have to hide it away, maybe you leave it on your countertop or your coffee table, and the dog gets into it. So maybe you're a little less interested in keeping it secure. And obviously more people, it's no longer illegal. If it's illegal for recreation, you're going to try it, and maybe you don't like the brownie, so you put it on the table and the dog gets it. So it's not surprising that the exposures go up as these things become legal. So I wanted to look at the states that I wanted to know why those edibles were going up so much. So I said, well, let's look at the states that have legalized recreational marijuana. And so I looked at California. I looked at all of them, but this is the one I chose to put in here. And in 2014, California made recreational marijuana legal. However, the first sales didn't occur until late in 2015. And as you notice there on the graph, that 2015 to 2016, the numbers went up, and now edibles far outweigh all the other forms of marijuana. And that includes hemp oil in things like body balms and soaps and stuff as well. So edibles have really gone up, and I said, okay, that's it. You know, recreational marijuana gets approved, the edibles go sky high. So then, and it worked out for all the states that had recreational marijuana approved, which got to me because I got to Massachusetts, and they've approved it, but they haven't sold a single piece of recreational marijuana because it's still not legal because their dispensaries haven't been licensed yet. So I was like, well, how did that happen in Massachusetts then? And then I look at Texas. And Texas has some of the strictest cannabis laws in the country. It does allow low THC, high CBD products to be sold, but that's pretty much it. We see the same pattern in Texas. And so all I can conclude out of this, it's not that it's recreational marijuana being approved that makes the edibles more popular. It's just that we Americans like our edibles. Clinical signs of marijuana, you've probably seen these before. Nothing new here. There's certainly other publications that have shown this as well. Ataxia, CNS, some form of CNS depression. Vomiting is common, which is kind of ironic because one of the medicinal uses of marijuana is as an antiemetic, but in dogs it triggers vomiting. Urinary incontinence, dribbling urine, classic signs. Tremors, fasciculations, and all the way up. So, you know, again, usually not too bad. But what we found out was there's what I call good pot and bad pot. And good pot is your classic marijuana, your old-fashioned marijuana, what I saw when I first started at Poison Control Center in the 1990s. These were your dogs that were hyperesthetic, they were groggy, they either had mydriasis or meiosis, they were bradycardic. If they were bradycardic, dribbling urine, and hyperesthetic, they were marijuana unless proven otherwise, right? Sometimes if they got really severe, we'd see some tremors or head bobbing. But in really, really rare occasions, we'd get some that would become stuporous or even comatose. But we never had a death. And up until 2000, when we published a paper on marijuana toxicosis, there were no deaths involved. Usually not life-threatening unless by misadventure, i.e. they fell down the stairs or fell off a cliff or something like that. But usually it's not life-threatening. However, in after about 2010, we started seeing other signs that we hadn't seen in the past. And a lot of these were coming out of California. And the signs were more what many of the emergency clinicians were telling me were serotonergic in nature. In other words, they were seeing hyperexcitability and agitation rather than sedation. They were seeing vocalization. They were seeing tachycardia instead of bradycardia. They were seeing hyperthermia in absence of significant tremors. It seemed to be more of a primary hyperthermia. They were starting to see a lot more seizures than they had seen in the past. And we saw a lot more comas, and we started seeing our first deaths. And so we called this the bad pot, okay? And so what's going on here? Well, one thing we found out was happening in California is they were growing pot that was a lot more potent. They claimed that the THC levels in pot went from somewhere around 1 to 3%, and now they're up in the 18 to 30% range. So much, much more THC in there. But as has been mentioned by both of our other previous speakers, there's a lot more in marijuana than just THC. So we don't know if there's higher THC level is responsible for this, or if there's some other component within the marijuana that's being increased at the same time the THC is being increased. And we're starting to see these more severe clinical signs in some of these dogs. So again, the big thing is a lot of the clinicians I've talked to, they said it's like a serotonin syndrome. So I'm beginning to wonder if there's some serotonergic component in marijuana. The other thing is most of the deaths that we've seen have been involved with marijuana butter. Marijuana butter to make brownies or marijuana butter by itself. And do y'all know how to make marijuana butter? Oh, you really should. Come on. You just take a stick of butter, you put it in a saucepan, you turn it on low heat, you throw the pot in there, you put the lid on it, and you let it steep for several hours. You suck out every last bit of THC out of that plant material, and it's in that butter. And the difference here is when we talk about a dog, say, swallowing some cannabis weeds, some of the plant material, it's going to take him hours for that THC to fully come out of the plant and get into his system. So it's going to be released slowly over time. So our syndrome is much, much less severe. When we get these animals that get into the marijuana butter, that extraction has already been done for them. And now they have a ton of THC. It's extracted and it's also concentrated. They get a lot of THC in them and other components, again, of marijuana that may be involved in some of the syndromes we're seeing. So I think that's why we're seeing what we call the bad pot. And then when I first asked for the data on this, I asked for basically cannabis and the edibles and all that together. But the programmer who did it decided he was going to be nice and go out and find out what else was in marijuana. And he found out that hemp was marijuana, so he went ahead and searched for hemp and cannabidiol and a lot of other things I wasn't necessarily looking for, but it turned out to be interesting anyway. So we talked about cannabidiol. They've talked about it plenty here. It's supposed to be non-intoxicating. What we found, if you look here, the overdoses are similar to THC in signs, with one great exception here. And if you notice, seizures. Seizures accounted for only 2% of the cannabis cases, but account for 15% of the cases that we saw in the data when we got it out of here. So actually it was 15%, and I got 12%, but I think it was 15%. Well, that is 12%, okay. And so don't know why. And that was a total shock, and I still have to go back and look at those individual cases and make sure we're not dealing with some kind of aberration in those cases. But with the cannabidiol, again, just like the good pot, no known deaths. And again, then when I looked at the hemp and hemp oil products, the data that they gave me as well, we saw the same situation. They're showing the classic marijuana signs, the ataxia, the lethargy, the tremors and fasciculations. Let's do your live poll question. So we're going to talk a little bit about how to manage a case, because you probably are going to be seeing these. What's your comfort level in managing a marijuana toxicosis in dogs at this point? And you have your options there. Okay, so a lot of you are already pretty comfortable with dealing with these. So our options are, the green is to, you've managed them before, feel comfortable. B, haven't done one but think you could. C, you've managed plenty of cases, it's pretty routine. D, have never, not comfortable at all, probably refer. E, haven't dealt with one but can't wait to manage my first one. And F is, I've seen so many of them that I think I'm bored. I'm tired of them and I wish they would go elsewhere. So, okay. Can't even remember what my answers were. So good, sounds like you guys are all ready for October 17th then. Diagnosis is primarily clinical signs and history. Oh, and I'm supposed to turn her on while I did this. So here's this is a really mild case. You want severe cases, go on the internet. A lot of people like to get their dogs stoned and video it. Clinical signs and history, some people are going to be more willing to admit that it's marijuana involved than they had been in the past once marijuana is legal, but don't rely on that, because many people still think there's a stigma involved in it. And the other thing to remember is, if you look back and see, the cannabidiol and the hemp all had similar signs as well. So the dog may have gotten into something that wasn't pot in the house. It might have been something that was a hemp product or something with cannabidiol in them. So you need to do a little further history with folks to find out on that. You can consider using over-the-counter test kits. I assume you all have those available at pharmacies in here in Canada like we do in the US. You can go to the pharmacy and pick one up. Some of them seem to work. First Sign and First Check. First Sign you can buy on Amazon. It's about $10 a test, and folks are having success with it. We do get lots of false negatives with some tests, and it might not necessarily be the test. It may be the timing, because you get the dog, he gets into marijuana. Within 30 minutes, he's starting to show signs of intoxication. And so they come into you within an hour or an hour and a half of the dog being exposed to it. These tests do not test for THC. They test for the metabolites. And so in an hour and a half, a dog probably hasn't metabolized enough to have enough metabolites in its urine for those tests to pick up. So when they're negative initially and the veterinarian calls me and says, I know it's positive, I know it's pot, I always tell them wait 6 hours and redo the test. And certainly quite a few of those have come back positive. So what happens is we get them too early before they've built up enough metabolites in their urine for the test to pick up. You need to read them properly. Many of these tests, we're accustomed to the test turning color as a positive. Many of these tests, if it turns color, that's actually your positive control. So a negative is no color development. I've had several people tell me, oh, he was positive for everything except marijuana. I don't understand that. And I said, well, are you seeing a bar or are you seeing nothing? Yeah, I see a bar on all of these. Well, that's your negative control. Your marijuana was positive. So make sure you keep the instructions if you don't, so you can check your results. And these tests are not validated for animals. If for any reason you need to prove in court that this patient was affected by marijuana, you will need to back that up with some type of validation. Generally, just take some blood or urine and send it to a veterinary diagnostic lab and have it screened for THC or its metabolites for proof. Because these are screening tests that even in people, they should never, ever, ever be admitted in court, because they're just screening tests. Lots of false negatives. I tend to believe a false positive, especially if it's associated with the clinical signs I'm expecting. Any of the cute pictures you're seeing on here, I stole off the internet, by the way. Management, there's no real antidote. Most of these animals are going to recover with symptomatic care. Keep them warm, keep them from hurting themselves, treat any signs. If they're agitated, go with a sedative. Monitor their vital signs. If they get too cold, warm them up. Manage any severe cardiovascular problems. If they're really bradycardic, check their blood pressure. If they're not hypotensive, maybe you can go without treating them. You can certainly give them just a titch of atropine to get the heart rate back up if they're getting hypotensive. IV fluids, just good for general supportive care, and also can help with your blood pressure. Activated charcoal, if they can swallow and you're not worried about aspiration risks. And for really severe cases that are circling the drain, many folks have had luck using intravenous lipid emulsions in those dogs that are in really, really severe severe situations. I wouldn't pull out the lipids if you have a dog that looks like the one in the video I just showed you. Clinical signs last 24 to 72 hours. Sometimes they'll be ataxic for a couple days beyond that, but generally we don't expect any long-term issues. In summary, what do you expect? Expect that once marijuana is legal, you're going to see an increase in exposures. You may see a little bit of a lag period before you actually see those. Edibles are very important, so it's not anymore, you just have to ask them if they're cannabis. You need to make sure that there's no potential for edibles being in the household, and also those hemp and cannabidiol products. You may see more severe clinical signs than we've seen in the past, and I'm not sure that the literature has caught up with that yet. You may see more willingness for people to own up to the fact that the pet did get into marijuana, and again, expect most to recover with symptomatic and supportive care. And I stole that same picture that Louis did. Okay, and we're going to have questions after the break. Okay, thank you.
Welcome back, everyone, from the break. This is the question answer portion of the afternoon. Our three panelists are up here to entertain any questions. We have 2 microphones set up. So if you'd like to come up and ask a question, by all means, please do so. There have been a number of questions submitted on the app as well. And so I think I would just start off by reading this first question, and any one of you can entertain the answer, and we'll go from there. So the question is, once the bill passes, will CBD products be able to be marketed legally as natural supplements? What regulations and requirements are in place for this?
It's for Sarah.
I can try and tackle this one, and so I'll just start. I'll start by saying we're still trying to figure out exactly what all the new Cannabis Act regulations are really going to mean. Initially, Health Canada, in their proposal for how they were going to regulate cannabis with legalization, had suggested that they would create a new pathway for CBD-containing products to become approved as natural health products on the human side. They did not make any mention at that point of it being classified as a veterinary health product. But now that we see the final report of the Cannabis Act, it would appear that they have backtracked away from that and instead are going to be listing all plant-derived cannabinoids, including CBD, on the prescription drug list. So that would make me believe, at least at this point until we get further clarification, that CBD won't be available as a natural health product, but instead it will be allowed as an ingredient in prescription drugs. Stay tuned, though. That might change. Maybe we've misinterpreted things.
If we invite anybody that has questions, there's 2 microphones, so if you have any questions, bring the microphone to you as well. Otherwise, I'm going to get going on more questions that we've had submitted. So it's not really coming from me, but
Anonymous.
maybe a few friends of a
Can
friend.
I grow
exactly.
cannabis?
So this goes again to the question that I think was just had. After the bill passes, what legal ways will clients be able to acquire CBD products for their pets? I don't know if we need to answer that question again. We really don't know, but.
So if it's, we won't yet have prescription drugs approved because that process is going to take several years. If it's not approved as a natural health product, that means that clients will be able to access CBD products through the retail outlets that are permitted under the new Cannabis Act. So depending on your province, that either means, in Ontario, it's the Ontario Cannabis Stores. In BC, it's going to be both a provincially regulated or a provincially run outlets as well as private dispensary type licensed retailers. And so it'll really be up to those companies that are doing the retail side, whether they choose to carry strictly CBD type products. But I imagine they will. They'll be able to carry initially both dried flower as well as oil. And so just like on the medicinal side where we have oils available that are high CBD, low THC, I wouldn't be surprised if we start to see those products on the adult use or the rec side of the market as well. Not that they're very recreational to use if they don't have THC in them, but I think they may see that as a potential revenue stream from people who still want to access CBD products, but maybe don't want to go through the hassle of getting a medical document for that.
Do you want me to bring the microphone? Or
we're not permitted to give a recommendation. So will you be potentially petitioning our different governing bodies to allow us to actually provide some kind of recommendation instead of us having to say sorry and the owner's going to go on Google? And
I think all the provincial regulatory bodies recognize that this is an area that's developing rapidly, where clients have a lot of questions and where veterinarians do need to be able to have that conversation. Exactly what will be permitted within the context of that conversation, I think, will be up to their decision. I know that they're all meeting at some point this week, and this topic is on their agenda, so I'm eagerly awaiting to hear what they say too. I'm hoping, as I'm sure many of you guys are, that they will come out and say, you know what, we know those products are out there, we know your clients want to use them, and that they're going to use them one way or the other. And so as veterinarians, to me, it only makes sense to offer the best service and care for our patients, that we be able to have a conversation and offer them some guidance as to what they should be looking for, what they should be steering away from, and sort of how to dose within what limited information that we currently have, because we just don't want them to go buck wild out there.
yeah, so would it potentially be a matter of your organization working with the CVMA to come up with a position statement to guide our different governing bodies by province?
Go ahead, Shane. I saw you jump to the mic there.
Yes, thank you.
Just make sure this mic's turned on. Is it turned on?
Yeah.
Should mention this session is being recorded too for posting later. So try to disguise your voices if you can. And the slides will be available too later on. In terms of advocacy, yeah, CVMA has already done quite a bit in the past 6 months to a year in terms of advocating for the profession. And we'd like to hear what you think. And we'd like to continue to bring forward our the points that we recommended to Health Canada only 6 months ago. You know, I think Health Canada's told us that they're very receptive to our voice, and we'll continue to advocate. So whether it's through a position statement or letters to the minister, further consultations one-on-one with staff at VDD with your input, we'd be happy to do that. We have an ad hoc advisory group that we put together. Sarah and others are part of it, and they've been very helpful so far in providing advice to the National Issues Committee. So I expect that's going to continue on in one form or another. And yeah, we're here for the profession in Canada for sure. I had a question too, totally different, but I'm wondering about applications in other species other than dogs and cats, particularly horses. Any anecdotal information on potential therapeutic benefits in horses or other large animals?
Other than ancient Greece, where the I did talk about horses. No, I don't. Actually, I don't have any information, but I think it is used sometimes topically on some horses, and I've heard about that CBD being used as a topical. But
yeah, I've seen products that are being marketed for the equine market, CBD products with varying dosages being thrown out there, and certainly within sort of this little, there's a veterinary Facebook group where veterinary technicians and vets share stories there. And there was one thread talking about CBD use in horses, and anecdotally, the responses seem great. Helps them recover faster after events, reduce inflammation, reduce anxiety. But I haven't seen any clinical research on the equine side.
For sure, they have receptors.
I may just add to that briefly before our next question, and that was related to a question we received, which was how do we as a profession regulate withhold times for potential cases where owners may opt to self-medicate pet animals and or other, I assume, farm animals that may end up in the food chain, so such as horses. Do we have any science on cannabis withhold times, or do we just ban its use in these animals until we know more?
I certainly think that we're going to have to, if people are going to start using it in food-producing animals, we'll have to get those studies done to look and see what the withdrawal times need to be. The people joke about feeding it to beef because the cannabinoids get sucked up by all the fat tissue, and wouldn't that make for a great steak? But realistically, it poses a real challenge. And there are some studies that have looked at cannabinoids being transferred through milk from dairy cattle, and we know that it can be passed through the milk. So certainly, I don't see this entering into the food producing market anytime soon before we get more studies on that.
I have Jim Fairless who just wants to make a comment with respect to that.
Just a quick comment about use in food animals. When you talk about withdrawal times, you need to there needs to be a minimal dose that is set, and without that, the dose is 0. And with current laboratory methods, a veterinarian's going to be out really by themselves if they're recommending anything. So I wouldn't recommend going there right now.
I would say that I'm pretty sure there's some THC in the corn that cows eat on a regular basis from what I've seen in my years traveling and finding things that didn't look like corn. Sure.
Is that where happy cows came from?
I'm finding it a bit confusing about if what you've said about the this October legislation that's going to put cannabinoid products into the prescription category. Wouldn't that just put that in the same category as all the other prescription things, so veterinarians have the option of off-label use?
Yeah, and certainly as drugs,
and there wouldn't be any, big risk or need for position. I mean, we don't have a position statement on the use of Valium in dogs.
No, that's true. But that's as they develop and get approval for new drugs that contain cannabis. So that doesn't necessarily pertain to cannabis as the plant, or cannabis in dried flower format, or the products that are currently available in the Cannabis Act. But as we move forward, we're going to have companies developing new drugs, and those drugs will be on the prescription drug list. But you're right, it's confusing. I don't claim to fully understand how they balance that all phytocannabinoids are on the prescription drug list, and except you can go into your local store and buy cannabis without a prescription. We're waiting for clarification. I know the CVMA National Issues Committee has also set up a call or is requesting a call with Health Canada to clarify. Yeah. I share your confusion.
On the matter, is there an ability to access that information presently? I think you'd indicated that. You'd mentioned that the CVMA has an advisory group looking into this. So is that information publicly accessible, or?
There is there's a cannabis section on our website. There's a copy of the letter posted on the website that we wrote to Health Canada recently. So there's a product of the working group, dated I think January. But we clearly will have to organize ourselves more, and we hope to have further information posted, usually by the web or directly to members.
So I have a question on use of cannabinoids. So a lot of what we do is pain control and a lot of chronic pain control. And I know all my clients are using it, and I know I can't legally say anything about that, but we do. So my question really is, I've got animals on multiple drugs for pain control. Where do I fit cannabinoids in? If I'm not telling them to use them, when do I not tell them to use them? So, you know, they're on meloxicam, they're on amantadine, they're on gabapentin, so for chronic OA or whatever. So where do I rationally put cannabinoids in there?
Well, I don't know if I can answer the question precisely, but you can add on. But I personally, currently, when I have clients putting their dogs on products, it's not on my recommendation. I will discuss it with them if they open. I mean, I won't bring it up, but if they do bring it up, I will have a discussion with them. My patients might not be your patients. I mean, are not your patients. They're very often it's end of life, advanced cancer. Failing traditional therapies. The ones that really do not want to use traditional therapy won't come to me. They may come to people that do holistic medicine. That said, we don't know all the interactions with cannabis and other drugs. So when you introduce that on top of 2 or 3 other drugs, it becomes polypharmacy, and one could say that whole plant extract are polypharmacy of their own because they don't contain just one cannabinoid, they contain a mixture of things, right? So you're introducing a drug with many different compounds to a group of compounds that are already on board. So you're opening up for the risk. To me, to answer your question, I would eventually see them coming in earlier on, and the Cornell study suggests that, right? It has some efficacy. So once you know it's safe and you have a dose range and it becomes legally prescribable, then early on. Right now, you have to go with what's legally prescribable first, and then let them decide if they want something that's technically illegal, but likely safe and likely effective, right? So to me, it's an add-on. If it's added on other things, with epilepsy, we know that from studies that if you add it on top of other epilepsy drugs that didn't work, so the animal is an epileptic dog that still has seizures despite 2 or 3 anti-seizure medicine, and you add, for example, CBD, and the dog stops having seizures, you can start weaning off the other drugs probably, and in some cases, hopefully stop them. And the same is happening with patients on high doses of opiates where they can eventually lower their dosage and in some cases stop opioids, where cannabis finally is better than what they were on. But in a dog that's on NSAID plus gabapentin plus something, where does it fit? That means he's on 3 drugs, it's not working, so you add it on, it's the owner's taking the risk right now, and you're helping them maybe, that's the part that where the legal aspect comes into play. But to me, there's always I think of the risk of drug interactions. We know that CBD also has to go through the liver. P450 enzymes play a role. The PGP also, it's a PGP substrate, and we were discussing that a little bit. THC might not be, but CBD is, and things like that. So there's drug interactions that are going to be part of that, and you two may add to that.
I'll add that I heard a very wise man speak at a conference talking about the human medicine and where cannabis fits in that same situation with things like chronic pain. And, you know, human physicians are often advised that, you know, with chronic pain, you start with an over-the-counter, a Tylenol, an Advil, then you move up to your prescription NSAIDs, and then maybe you start adding in something like a gabapentin, and then you move up to your opioids, and only as a last resort would you then add cannabis in. But I think, you know, especially as we get more research coming in, that sort of needs to be turned upside down, and cannabis will need to be moved down to one of the first line things as we start to see, you know, its effectiveness and, you know, a greater safety margin than even some of our over-the-counter products. On the veterinary side, we're still a ways away from that, but I tend to agree with LP, given some of the preliminary studies coming out, it would be great to see products that are, you know, for instance, mainly CBD, lower THC, coming in earlier in the stage, almost like what we start with disease-modifying supplements at this point.
And I think I just want to add, because as she was talking, I was thinking and listening, that it really depends also on what type of pain we're treating, right? And I don't know, I don't count how many dogs I've seen where the owner tells me that, oh, my dog has hip issues, hip disease, so osteoarthritis and dysplasia and such, and the dog doesn't have any hip issue, has, you know, lumbosacral pain. So that dog maybe actually the NSAID helps the dog a little bit, but probably cannabis would help him more because that's neuropathic pain. So you'd have to understand which mechanisms are involved, what type of pain. Is it bone pain, osteolytic bone pain? Is it inflammatory pain? Is it neuropathic pain, somatic pain, etc.? And really be a little bit more specific about that. And that's not just me being picky. It's logical that when you use gabapentin, it's for some sort of pain, and maybe gabapentin works best for that pain that NSAID wouldn't, or the combination of them is better than either of them alone. And that applies to adding something to it. In addition to what she said, in addition to the risk of interactions. But whenever I have a patient that has more than 5 drugs, I always try, and I have some that are on 12 things, and yeah, they all have a reason, but then you start to wean them off, and if you could wean them off, and maybe, I don't think cannabis or derivatives will be the cure-all, but I think it will be an important, eventually, and what I'm hoping for is that it'll become a very important part of our arsenal, and it won't be one part, it will be multiple parts, because there'll be different ratios and this and that, and we'll be able to fine-tune it. Right now, in people, what they say is, take this, it's low CBD, low THC, high CBD ratio, and then eventually you shift the ratio and you find the point where you feel the best with your disease, whatever it is, like multiple sclerosis or something, and you find the ratio that's your ratio. And these patients sometimes have two, like when I feel like this, I take this one. When I feel like that, I take that one. And it's really touch and like it's a trial and error.
It's very individualized.
So to say that we add a cannabinoid on top of something else, what is that cannabinoid? What are we doing? What's the ratio? What else is in it? Is it purified? Are there, is it a whole plant extract? It's not a simple answer, I think.
Thank you.
But it's a great question. Can I just, okay, so Dr. Huntingford is here, and she does have an ESC. She talked to me afterwards, an experimental certificate to...
We're certified, or should be certified. I have a couple of things to bring to your attention from the clinical research side. One, Joe Washlag's paper was accepted for publication in Frontiers, so it will be out soon. Curtis Dewey is doing a seizure study on CBD, and I was talking to him a couple of weeks ago, and he told me works best in uncomplicated seizures, and has had issues with clients reducing drugs, like you were just talking about that. When they add the cannabis, they always want to reduce those really expensive seizure drugs. And he said, maybe not. And the dosages are probably higher than what everybody thinks they are. The study that we're doing is with a water-soluble purified CBD product. So there's 0 THC in it. And what we are finding is it plays well with something else. So you can use it for chronic pain. It seems to work like gabapentin. That just from what you wanted to, and looking at how the pharmacodynamics work, that appears to be how it is. So when something like that is approved, it needs a helper, because we've had dogs who just were on that, and in some cases that worked well if they had hip arthritis. But if they truly had neuropathic pain, they needed something else too, an NSAID or something like that. We haven't seen with the pure CBD product that we're doing, we haven't seen a lot of issues with liver enzymes. We did have some dogs whose alkaline phosphatases went up a bit, and then we tested them after they had been off the product for 4 weeks or so, and they'd come back to normal. And from having a discussion with Joe Washlag, Justin Smallberg at U of F is doing some work on this too. I think that the dogs kick this stuff out way faster than we do. So I've no idea what happens in horses or cattle or anything else, but they seem to kick it out a lot faster than we do. Although there's some thought that there may be an accumulation.
Can you clarify what you mean by kick it out?
Yes, the PK on these dogs is really fast.
But that's plasma PK,
yes.
Right? So I'm sure it's longer in tissue, especially in fat.
Yeah, it
and that's the
probably
problem
is.
When you eat steak, right? Especially if it's Angus.
But it has a really big first pass. So
but I'm sure that it's probably I don't know the answer to the question earlier. I was going to say something. It's stored in fat. It's probably, I doubt it's more than 3 or 4 days, but After that, the plasma PK is completely different.
Yeah,
and the,
well,
and the CNS.
well, see, then somebody can research that, right?
But
You can
I'm going to ask you a
do
question
that.
about your product. You said
Yeah.
it's purified CBD, no
Uh-huh.
THC, but that to me doesn't answer the question, which is it a whole plant extract? So are there more than just CBD? There's no THC, but is it just CBD
It's
alone?
just
Purified?
this one is purified
So no
CBD.
terpenes, no
There's no
flavonoids. Okay.
terpenes, there's nothing in it.
Okay, cool.
Yeah, so it's an interesting thing. This company is really wanting to head towards the human pharmaceutical realm, but they need animal studies.
Yeah. So you're a stepping stone. Okay.
Yeah, that's pretty much it.
Excellent. Thank you for the clarification.
So I'm going to ask another quick question that we received. When we have treated some of the bad pot cases, we have seen several have paradoxical reactions to benzodiazepines. Has this been seen elsewhere?
Yeah, actually, even though I put benzodiazepines as one of the sedatives, I tend to stay away from that. What we find, if it is something serotonergic that's going on, then phenothiazines work better. And I know there's the old saw about, acepromazine lowering the seizure threshold, and I can tell you that all comes from an old paper that has no basis in clinical reality. So you can use acepromazine on these guys. What we generally recommend is start them low and move them up high. And we do tend to see issues sometimes with benzodiazepines. Now, with Valium, a lot of times that I've seen the paradoxical reactions, it's because it was injected too quickly. I think if you have to use Valium, it's the only thing you've got, you need to use it, inject it very slowly, because when you blast them with Valium and they're already somewhat semi-agitated, it does seem to sometimes make them worse.
My question is, it could be a very simple one, maybe has a very simple answer, but how is it different for us as individual veterinarians who are able to prescribe and speak to our clients regarding traditional Chinese medicine, or even Ayurvedic medicine, or even naturopathy? How is that different, except for the fact that cannabis and cannabis molecules have been erroneously scheduled or labeled as Schedule II drugs? How is, we have the latitude to recommend treatments that don't have a vast scientific background, yet we are limited by our association to speak to our clients about a rather efficacious molecule that has some great benefits.
I don't have an answer for you other than yes. Yeah. And these are the things that I think they're going to be taking under consideration. I hope that they'll be taking under consideration. And I'm sure because this area is changing so quickly, as a profession, we just need to keep moving that bar up and adapting to the new world that we're living in.
In the human realm, I guess there's reported great variance in people's effect with marijuana, and I was curious to know if you'd seen any of that same variance with companion animals, and say, for instance, with breed-specific reactions or anything like that.
Have you seen?
No. Oh, you're at me.
I don't know who it's
for you using
intended
clinically. I didn't really look at the breeds that hard from the data that I had because I was looking at some of the other factors, but there wasn't anything that surprised me when I did pull the breeds out and kind of glance at them. It was the same Labrador Retriever, German Shepherd, the ones that are always in the top 10 for animal poisoning. So from a toxicology standpoint, when I did not see anything on my short glance, but again, I need to examine the data a little closer. And I know from experience, you sometimes get a feel when there's a breed-specific issue. However, that being said, with any medication, whatever you want to call it, you're always going to have individual variations in response. So And I'm looking at it from a toxicologic standpoint, so I'm looking at overdoses. You all maybe can address therapeutic.
Well, I can't say that I've seen many patients that switched from one to another. I've had clients that had medical marijuana for people with different ratios and different strains that tried 4 or 5 different things, and they saw different effects. The dog was more sedated there, less there, so things like that in the same patient. I've heard through the grapevine that Chihuahuas seem to be more resistant to certain side effects, but I think they just have hydrocephaly. They have less receptors because they're pushed out by the hydrocephalic brain. I don't know. Otherwise, my question for Sarah was, she did something recently, a webinar, and I had sent a question that she never answered live, and she came to me today. Did you ask that question? Because they're anonymous, and yes, I was the one that asked. It was about PGP and MDR1, and we kind of talked a little bit about it earlier because I was interested in knowing if maybe the typical, ABCB1 breeds were at risk of more side effects. And I did communicate with Katrina Mealy directly, who's at Washington State University, and she's, MDR1 goddess, and she didn't know actually. So there's some unknown, I think, but definitely in people with technically the same disease, they respond differently to different strains. So is it because their disease is not really the same, or physiologically they don't, it doesn't work the same way? What I can tell you is a parallel from cancer, and it's not at all answering your question, but to me, that's probably true of many diseases, is you can have the same tumor on histopath, and you look at the genotype of these tumors, and completely different, and one of them will respond to this chemo and the other one won't, but under the microscope they look identical. So to me the same will be true, and a lot of it with these compounds will be trial and error. So if a study is done with a set group of dogs with a set disease with this compound, and it's purified and it's repeatable and they can do the same thing all the time, and the response rate was 80%, I will tell clients your dog has an 8 out of 10 chance of responding based on the data, right? But in an individual patient with all the anecdotal stuff right now, it's trial and error. So to me, yes, the answer is yes, there's differences between all individuals, maybe some breeds, and that'll surface eventually when data becomes available. That would be my long answer.
Yeah. I think on the human side, most of the cannabinoid doctors out there and most of the licensed producers also recommend that human patients, when they start using medical cannabis, keep a logbook. What are your symptoms? What are you taking? How much are you taking? How did it make you feel? So that you can go back and you can track your response to different medications. And I think having a modified version of that for veterinary patients makes a lot of sense too. The only difference, of course, is our patients can't tell us directly how they're feeling, so they rely on us to make really close observations about how they're doing and then adjust their medications accordingly.
And just to add a quick thing, because Dr. Huntingford, she's still here, because I'm not a neurologist, and earlier you talked about the seizure patients, and it made me think, like, why did I mention that? Actually, it's because I work with 2 neurologists, and they do get the question regularly on their listserv, the ACVIM listserv, about CBD, but some patients apparently have been taken off other meds, and they were on 3 anti-seizures. So I was not saying earlier, do that, by the way. None of what I say today is do that. But it's been seen, and in some cases, for some maybe very specific patients, it seems that this drug works better than others. And for others, it's all about combination therapy and an add-on, really. So, sorry. Go ahead.
That's okay. Jan Robinson, I'm Registrar and CEO of the College of Veterinarians in Ontario. And I just wanted to put just a little bit of context, if I might, as a remark, in terms of where, at least in Ontario, where the regulatory conversation has been, because I think sometimes it's taken a bit out of context. And I thought, Sarah, you did a fabulous job in terms of explaining where things currently have been, and there has been a bit of urban legend around the concept that veterinarians couldn't speak to their clients about the use of cannabis, and that actually isn't so. In fact, it makes good sense that, and I think it was said quite a few times, that we would support across the profession, inclusive of regulators, of clients going to veterinarians and getting the best information that they could. It's short of treatment options at the moment. And part of that's about the science, as we've been hearing today, but part of that's about the current normal has been that it's been illegal. So that's the challenge as a licensed professional. In the regulatory community, we're in the same place of trying to look at what's the next new normal. And it's been a shifting place to try and understand where medical cannabis has been moving, the absence of the veterinary discussion in that broader federal discussion, trying to have conversations with the government about that and making sure that we're clear and giving the best advice we can to the veterinary community. So we haven't, as has been said, had what I would call a broad, deep conversation at the Canadian Council of Veterinary Registrars. It is on our agenda in our next 2 days of meetings. But really, it's going to be quite very much about collective leadership around that, because we're trying to understand the scenario as well, so that all of us, inclusive of what was being said from CVMA, is to be, again, giving clarity to something that isn't quite clear, because even the new act hasn't been released yet. So we haven't even seen the language to know exactly where things have come down.
I'll send you a copy.
So I just wanted, that's great. My understanding it's being published, I think this week. Anyway, on e-laws, but I just wanted to give that context, because I think there's sometimes the regulatory community is seen as a barrier where there's actually been a lot of work wanting to understand so that we can all be clear.
Yeah. Thank you so much, Jan, for standing up and speaking. I was hoping you might jump in on that conversation. I can certainly say my conversations with the CBO have been really positive ones. They've been really open about this area and discussing, but I can't say the same for conversations with the other regulatory bodies. I just haven't had the opportunity to speak with them directly, so I kind of have to tread lightly on that one until we know where their standpoints are.
I can add that the myth of you can't talk about it to the clients exists, because in an oncologist I know in California called the California VMA and asked the simple question, can I at least talk to clients in the exam room about it? And the answer was, be ready to lose your license. And that's in California. So, which was, I thought, surprising. And it was about CBD. The question was about CBD. So it does happen, and I'm not saying this is in Canada, but. If the owner went home and said, my vet told me I could use this milligram per kilogram, not that it killed the dog, maybe it didn't even, technically that's how the answer sounded. If it said it'll be like walking on a broken plank over shark-infested water with no one to hold your hand. That's what the person was told by the California VMA representative. So, which you take it. I have just one little thing, because I had two questions with multiple choice questions that were not live questions that I asked, and 40 of you responded. And I just want to quickly look at, I said, like, if it was legally possible for veterinarians to prescribe cannabinoids today, which of the following would hamper your decision to do so? And I had multiple choices, but the most common answer was the paucity of published studies, second, and at 56%, and then the lack of certificate of analysis for most products at 25%. And then some people, like Sarah, said I would not hesitate and would prescribe it. And the stigma about pot and marijuana was below, and everything. The fear of side effects, only one person. And the other question was regarding the therapeutic THC, and so specifically THC, therapeutic THC in companion animals. Do you think, and then the choices were many, the 90% says more studies are needed to establish dosage, efficacy ratios, safety, etc. And then 5% said there's no good medical use for it in pets, which I was surprised. That's 5% is 2 people. That shows that the numbers are important. I can argue with them. And then one said it can be used, but only combined with CBD. And one said only at extremely low dosage. You would be surprised. So.
I have a question here from the app. Does anyone on the panel know if current DVM students are being taught about the ECS and CBD use in school?
I don't know for sure in other schools, but I'm 90% certain that they hear about it at the University of Montreal, because I know people that are involved with the pain group there, and I've discussed it with them, and they're involved with the curriculum, so I'm pretty sure they talk about it, but I'm not 100% certain.
Oh.
Could we use the microphone, please, sir?
Students that never heard
it's
about
being
it.
recorded.
Yeah.
So we're a group of students, so we're just entering our clinical year. And so it was mentioned that this was going to be like, you know, a hot topic and that clients are going to ask us about it. But then I don't feel that we've been given any tools. Like it was just sort of, you're going to be asked about this, but we didn't learn about the system. I didn't know that we produce endocannabinoids like within our bodies, that there were like receptors. That was not, in my opinion, detailed to us. So at least from our perspective, it wasn't in there, but maybe in the younger classes are going to get more of that.
If it makes you feel any better, I don't think any of the human physicians had any training either, which probably accounts for the blank looks that you get or the look of fear when you ask your family physician about using cannabis. So, you know, even if we get past the regulatory issues and everyone feels much more comfortable being permitted to speak about it, the next big hurdle, of course, is having the information to be able to answer those questions. So I'm not surprised to hear you haven't heard much about it. I know at the Ontario Vet College, Dr. Robinson put on a great lunchtime talk, which was extremely well attended last fall by both faculty and students. But I think it really needs to become part of that core curriculum, right in there with all the second year physiology and endocrinology and all the ology courses. We need that in there as well.
I can also reassure you that even if you didn't know about it, it's legal to produce endocannabinoids. We're all licensed producers here.
Yeah, I want to go back to livestock and use in livestock. Jim said that, you know, we have to be very careful regarding waiting times. But I was thinking about it, and I was discussing it with Anthony here as well. You can have pot-infused brownies. You know, you can have corn-fed chicken. You know, why can't you have high steaks?
I'm not opposed to it. I'm just saying it from a regulatory.
That's S-T-A-K-E-S.
No, but I mean, as long as it's of course disclosed to the consumer. You know, I could even see that there might be a market for you know, BC eggs and
yeah, I think, you know, particularly as the market starts to open up to edibles, I wouldn't be surprised at all if that becomes a niche market.
Chicken pot.
Pot chicken. Yeah, pot chicken.
Yeah, and you know, as an aside, you talked about chickens, and I know, you know, I've heard from farmers that when they feed just plain old hemp seed, you know, their animals produce so much better, and you know, the eggs have better color to them, and it's, you know, it's a great source of omega fatty acids and everything else. So, you know, who knows, maybe we're onto something with that. But the standard saying, we need more research.
So I'm going to just take one more here, and then we've got a final question on the side. So one of the questions that came to us was, of the toxicity cases reported, how many were accidental overexposure to pet products, as already we see so many being marketed to our patients?
Okay, I pulled those out. I had, yeah, again, the numbers don't mean a lot, but first off, the cases didn't start till, I want to say, 2013, so I'm assuming that's when most of these came on the market, and there were 189 cases of pets that got into the big containers of the cannabinoid. Most of them had cannabidiol, CBD in them, treats. And of course, the signs were very typical. Those were not included in the CBD stats that I gave here, because the CBD stats here, these were the ones that were coded in strictly as CBD oil. Right. I'm assuming 100%. And I did not include the pet treats on those, but I did have 189 of pet treat exposures that pets got into.
And maybe we can just add, because there was another question that was with respect to these products already being, if they're already if they're still illegal, why are they on the pet product?
I don't have an answer for that. They're sold all over the U.S., but technically, most of them are illegal because a couple of them have hemp in them, and the hemp is technically legal in the U.S. Well, and again, there are, if you remember the map, the light green states, in those states and many others, the low THC, high CBD products are legal. But I know that they're being sold in states where they're not legal, and I don't know why. It's apparently no one's going after them is the main thing. Nobody probably knows they even exist for that matter. DEA has bigger fish to fry than going after, Fido's little joint treat with CBD in it.
Yeah, and I think the same holds true on the Canadian side as well. The market is driving that whole industry, and legal and enforceable seem to be two very different worlds. So no, they're technically not legal, but I don't see a lot of those companies, being enforced. So they will continue to produce into market so long as there is a market that will be buying them. And right now that market's growing exponentially, it would appear. So.
Yeah, I was just wondering if you have any good resources for learning about the physiology of how the cannabinoid system works and how things are going to work.
Well, I'd love to direct you directly to the CAVCM website. But there are lots of really great websites out there. I had mentioned a Facebook group. I can't even remember now.
Veterinary Cannabinoid Society something.
Yeah.
something.
Veterinary Cannabis? No, veterinarycannabis.org is actually out of Colorado. Dr. Casara Andre has some wonderful information there. But there's lots of great information as it pertains to human cannabis use. And some of those sites also have sections on pet use as well. So there's one called learngreenflower.com. And there's a whole series of different webinars on there, anything from the business side to growing, but there's also big sections on medicine and science as well. Leafly is another great resource.
There's a few review papers that look at the endocannabinoid system and potential applications in pets. No very good one that I saw. I had Dr. Robert Silver co-authored a chapter on the endocannabinoid system, but I don't know, it's not published yet. I saw the chapter, it's like 190 pages. I thought it was, and he co-authored it with like scientists that work in the field, so it's very, very, very thorough, but it talks about the studies also that have been done so far, similar to what I discussed, but it's a very long chapter, but I have no idea what book it will be published in.
That's great. And sorry, I thought of one more great one, again, more directed to the human side, but can start to give you a really great basis on endocannabinoid system and cannabinoid medicine. And it's profofpot.com. And he's actually, they remain anonymous, but they are scientists that are working as a professor at the university level. But he takes all this scientific information and condenses it down into some nice, easy to read, you won't fall asleep. But then he cites all the publications that it comes from. So if you want to dig a little bit deeper, you can just click the link and go to the research paper.
There's going to be a conference at UBC September 28th to 30th at the Chan Center, and they have their previous conferences on YouTube.
Awesome.
I was just saying that there's going to be a conference at UBC September 28th to 30th, I believe, on cannabis, and they have their previous conferences on YouTube. And they're supposed to have some nice speakers there.
Do you remember what the name of that conference is?
Cannabis something. I'm sorry, I don't remember. But it's got a lot of like medical stuff in it, treatment-based stuff.
Just invite Shane up front for some closing remarks.
Just so you know, in Quebec, we abbreviate BC the other way around, CB, which...
Is that cannabis?
Yeah. Colombie-Britannique.
Just a brief word of thanks to our panelists and to our sponsors for a great afternoon. I think it was a stimulating conversation. We're just scratching the surface, obviously, on this, and it's kind of fun to be part of a wave of change. I think it's been a long time since we've seen this in our profession and in Canada, so it's a pretty exciting time, so thanks very much. In terms of next steps, I mentioned this is being recorded or was recorded, so it's going up on our website with the presentations, so the information will be there. We'll do our best to beef up our current resource section on the website as well. More things will be going up, CVMA's website. And next year, we have a National Issues Forum planned for 2019 in Toronto in June. This will be with WASAVA, the joint convention with WASAVA. Our planned topic is telehealth and animal welfare. So lots to talk about there as well. So thanks very much. June next year. Yeah. Next year? Enid, is it? I thought it was early next year.
No, it's July next year, and the year after in Quebec City, it's in June.
That's what I meant.
Yeah.
Don't change your travel plans. July next year. So thanks very much for participating. The exhibit hall is opening very, very soon, so plan to be there.